This is lecture 3 of research methods. In this lecture, I will describe types of research methodologies or research designs. As you will do your research, you should know what is your research design initially. Research design or research methodology is the general philosophy or the framework that includes general principles that guide your research. So, you should know what is your research design in order to follow these principles properly. Generally, you should differentiate between two important types of research design. These are qualitative research design and quantitative research design. For the qualitative research, you are dealing with subjective data, like words or pictures. So you are not dealing with numbers, and there is no statistical analysis. For the quantitative research design, you are dealing with numbers, or anything can be measured. So you have a statistical analysis. For the qualitative research, you will deal with words like discover, motivation, experiences, things, thought, problems, behavior. So you can see all these cannot be measured, but they can be described. For example, when you are describing pain or the severity of pain into mild, moderate, and severe, you can see you are using words to describe your data. For the quantitative research, you will deal with words like how many, test, verify, how often, how satisfied. All these seems to you are measuring something. The same example of pain can be changed to quantitative by changing the pain into number. So you measure the pain in numbers, not in words. In this case, you can measure the pain and do statistical analysis. So it's not a matter of which one is better. It depends on your data, and every type has its drawbacks and its advantages. Some of the commonly used research designs. Is interviewing or interviews. There are three main types of interviews. The first one, unstructured or in-depth interviews, semi-structured interviews, and structured interviews. In the unstructured interviews, the respondents have the chance to answer what they want, so there is a very little influence from the researcher. In the semi-structured interviews, there are specific questions that need to be answered in order to be compared with other interviews. But on the structured interviews, there are specific questions and answers that need to be selected. So the role of the investigator is increased in the structured interviews, while it's very little in the unstructured interviews. Focus groups or group discussion. In this type, a group of people will be asked to come together and discuss a specific subject, and the result of this discussion can be described later. Questionnaire is the most important one. Questionnaire in general is a document designed for seeking a specific purpose. It can be either self-administered by the respondent or can be administered by the researcher in an interview. The self-administered questionnaire is simple, cheap, can be sent by email, and with a little bias from the researcher, but the problem with this type is that it can be subjected to high rate of non-response. Questionnaire can be either closed-end questionnaires, where there is a question and there are specific answers to be selected. This is closed-end questionnaires. Open-ended questionnaire, there is a question with a blank, so the respondent can put his answer here without any influence from the researcher. This type is slightly difficult to be compared unless it can be coded, like negative, positive, and neutral answers. Or the questionnaire can include combination of both types. In general, questionnaire or the question inside the questionnaire should be clear and without any confusion, using simple words, and the researcher should be trained to deliver the question in a uniform way. The last type is observation study, which is rarely used in our field, but you should know that there are two types: direct observation, in which there is a study of participant behavior from one side, like using video camera or one-sided mirror. The second type is participant observation, in which the researcher immerse themselves inside a culture in order to know the behavior of these cultures. Research designs used in clinical studies. The design of clinical studies can be categorized into two main types: either observational or experimental study design. In the observational study design, the investigator do nothing, just stand away, observe and record. While in the experimental study design, there is an intervention done by the investigator, and it could be randomized or non-randomized, and the main example is the clinical trial. Observational study could be descriptive, like describing the distribution of certain disease, or could be analytic, in which there is an analysis or finding a relationship between cause and effect. Analytic observational study could be cross-sectional, longitudinal, and the longitudinal could be prospective or retrospective. Observational analytical study could be cross-sectional study or longitudinal study, and the longitudinal study could be either retrospective or prospective. In the cross-sectional study, the study is done on a specific period of time, so it's like a snapshot for a current time or any other specific period of time, while longitudinal study is done over a period of time, and it could be retrospective when the study or the measurements measure the current time and the past events. For the prospective study, the measurements are done for the current time and the subjects are followed over a future time also. Cross-sectional study. Cross-sectional study, it's a type of observational study. Could be descriptive or analytic. It means that the exposure and the outcome, or the measurements and the results, are done at the same time. It is also known as a prevalence study when we need to measure the prevalence of a certain condition or certain disease at a specific period of time. case control study. Case control study is also a type of observational, analytical, longitudinal retrospective study. Case control study, we should have two groups. A group with a disease or cases and a normal group or controls. Then we should go backward in time through their records or by interviewing those participants in order to know what is the possible cause of the disease. It's retrospective because we are going backward in time. For example, taking patients with lung cancer and normal subjects. By going backward in time, we can notice, for example, that those cases have greater number of smokers. In this case, we can suggest that smoking is a possible risk factor for lung cancer. It's important in this type of study that cases and controls are similar in everything except having the disease. And it's also important that they should be matched in their age and gender. So, in case control study, we have the end result, which is the disease or the outcome, and we go backward in time to know what is the possible risk factor. It's observational, analytical, and retrospective design. Cohort study. Cohort study is also observational, analytical, longitudinal study. It could be prospective or retrospective. In the cohort study, we also have two groups. But unlike the case control study, in cohort study, we are starting from the beginning. So these groups, one with exposure and one without exposure, like smokers and non-smokers. And then we can follow them forward with time and see what will happen in the future. What diseases will be happen here so that we can blame the smoking for this, and what will happen here. It's usually prospective because we are following the subjects forward in time. But in a retrospective cohort study, we are also starting from the beginning, but the disease in this case will be happened, and then we go backward to see how can we identify the causes of the disease by grouping the subjects according to the exposure factors, and then we follow them with time retrospectively. It is better than case control because we have greater control of the subjects from the beginning so that we can group them and identify or isolate the risk factor more properly than the case control study. In the case control study, we are starting from the end. We have the disease and then we go backward to see what are the risk factors. But in the cohort study, we are starting from the beginning and we will see what will happen at the end. These graphs will show you the difference between prospective and retrospective cohort study. In the prospective cohort study, we are starting from the current time and then go to the future. In the retrospective cohort study, we are starting from the past and come to the current time. In both cases, we are starting from the beginning. We are dividing the groups into exposure and non-exposure and see what will happen later. but the time of start is different. The main advantage of prospective cohort design is the ability to control and monitor the data collection and measure the variables completely and accurately. Usually, retrospective design is easier and cheaper when compared to prospective cohort design, and it's usually more efficient for disease with long latency, because the prospective cohort may require long period of time to be completed. Randomized controlled trials. Randomized controlled trials, or randomized clinical trials, or RCTs, are usually conducted to examine the effectiveness of certain drugs or treatments. So when you are doing a comparison between different treatments, it's the best design. It's usually prospective because you are doing the study over time to see the effect of treatment. It's characterized by random assignment. That means the patients are randomly selected without any previous specification. So we are not categorizing the groups. Every patient should be selected randomly. That's why it's the strongest clinical study to evaluate the evidence of or the effectiveness of treatment. It's experimental and randomized study design. Features of the randomized clinical trials. First, randomization, which means every patient or every subject has an equal chance to be selected in each group. When we are not grouping the patient according to our criteria, that means we are reducing the bias. Blinding. The investigator shouldn't know any type of treatment in each group. Just do the measurement and at the end unmask the group and know the type of treatment. This also can reduce the bias from the investigator. The protocol in randomized clinical trials should be written before, strictly, and it's preferred to be published so that there will be no deviation during the study. The sample size should be adequately calculated before the study. Ethical approval should be considered and obtained in each clinical trial. All the information should be given to the participants before the study. And one of the strongest points of the clinical trials is that there is what is called CONSORT, or Consolidated Standard of Reporting Trials. It's 25 points that should be considered when reporting clinical trials. That's why the clinical trial is the best clinical study when you are doing any comparison or any effectiveness of treatment. Hierarchy of clinical evidence studies. This is called the pyramid of evidence. In clinical studies, the evidence is based on the type of research or the research design. So the least evidence can be obtained from in vitro study, while animal studies can give evidence greater than that of the in vitro studies. After that, ideas or opinions of authors can give either higher evidence. Case report of one case is greater than ideas and opinions, while case series, which describe the results of different cases, is higher than the case report. After that, case control, and then the cohort is of greater evidence than the case control. Randomized clinical trial is the best clinical study to obtain the evidence for the treatment. On the top of the pyramid is with systematic review, which is usually collect the data of different studies that are either randomized control trials or cohort. So you can see that the evidence is increased by getting up. Systematic review and meta-analysis. As you saw that the pyramid of evidence is topped with systematic review and meta-analysis. Systematic review is either alone or systematic review and meta-analysis. In the systematic review, you are doing a thorough process of searching for a certain subject. And then, after getting all the studies about that subject, you are filtering them to get the best ones and then describe all these results into one finding. If the study with meta-analysis, that means you are also taking the numbers of these studies, the statistical analyses, and combine all the analyses into one analysis to get an overall outcome. That's why it's the best type of study design for any treatment. But it's not experimental study and it's not observational study. But it's a type of reviewing study to get the result from different clinical studies. Comparison of the different type of research designs. This table will show you a comparison of different types of research designs. In lecture 6, I will give you different types of bias, and then I can test your information about this table. For now, I will not go through this table in details, but I need you to read it carefully and to test your information. Generally, I want you to know that as we go from cross-sectional to randomized clinical trial, the study will be more complicated, but with more evidence. These three types of study usually try to separate between cause and effect relationship, with the cohort is the best, followed by case control, and the weakest is the cross-sectional. The same for this part of the table. Please test your information and let me know later. Selecting a research design. As a revision, in clinical studies, the design can be categorized into observational or experimental. In the observational, the investigator doesn't do anything, just stand away, observe, and record. In the experimental, there is an intervention in order to compare the effectiveness of drug or treatment usually. Observational study could be descriptive without statistical analysis or comparison between different groups, or analytic, in which we usually want to find the cause and effect relationship. It could be cross-sectional or longitudinal. Cross-sectional means it's done on a specific or a single period of time. Longitudinal usually done over a long period of time, which could be from the current time to the future or from the current time and the past. Please read the supplementary material, which includes different examples about these different designs and how to select the suitable design. Your study question can be answered by different study designs, but not always all the study designs are applicable.